just want to make sure. And we're good.
We provide a service to the community that is generally underserved, and we want to make the screenings available to every woman who has not been seen or has questions regarding maybe a PAP or a mammogram. We serve the community in different locations within the city and county of Denver.
Let's hear. So our main goal is just doing cervical and breast cancer screenings, and we are able to offer that to most people throughout Denver County. And today at Revision, we are working in this community setting in order to increase the screenings that we're having to reduce some of the disparities that we've seen in healthcare with people getting diagnosed late with different cancers, and that's kind of our goal, is to find things early and do preventative cancer screenings. So that is kind of on the mobile unit. We do go everywhere, but within the Denver County limits.
How does someone, what can someone expect to, essentially, what's the process to get someone to sign up and then get to the van? Can you just explain to me a little bit about that, that motion?
So we have a website and a phone number, so people can go ahead and call the number. English and Spanish speakers will answer the phone, and then we can always get a language line for any additional languages. But you can call, make an appointment with us, and they will walk you through different options as far as coverage and what discount programs and stuff like that are available, and decide on what location and what date works best for you. So we have a schedule posted online, and so we try to get people to schedule closest to their homes or their work or whatever's most convenient. And then you come on and you see either Olivia or I. So I do Pap smears and a family nurse practitioner, and we just talk a little bit about what your health concerns are, and go from there and try to connect you to services in addition to what we provide here. So if you don't have a home health location, our goal is really to connect people, in addition to the cancer screening, connect them to primary care services within Denver Health.
Gotcha. Can you talk to me a little bit about your philosophy, or the philosophy behind preventative health and preventative health, and kind of why it's important to, be proactive about that and catching things early?
Yeah, absolutely. So, cancer is a risk that doesn't really discriminate. Anybody has risk factors for different cancers, and we know if we can find cancers on the earlier end, we can treat with the less invasive treatments options possible, and prolong life and quality of life. So getting yourself screened as on an annual basis for mammograms, depending on your age and risk factors. And then with Pap smears, that also kind of changes. The screening guidelines are different based on your age. However, if we can find pre-cancer cells, we can treat things very, very early and avoid a really dire diagnosis.
So this event, how I got pitched it was Love Your Body, right? Or Amar Tu Cuerpo. And it's on Valentine's Day, and they have roses inside, some, I think some chocolate bananas and stuff like that. Is there anything you could muse about that, about just like the theme of loving your body and kind of, the service y'all providing here? And we'll wait for the door to close.
Okay. Go for it.
I think a lot of us are fearful about a diagnosis or kind of opening ourselves up to a probability of what could potentially be there or wrong. And I think it's a positive message to send to people that we do want them to love their bodies, but also we want people to love their bodies but trust us with their bodies, because all we want is good health, and we want people to have the patience and guidance and love to see us. It's a very simple process, and we're there to kind of navigate you through that.
Yeah. And I also think just as women, and we tend to put ourselves kind of on the back burner. We're taking care of families, taking care of children, parents, and sometimes our health comes last, and it's really important that women, love their bodies and put themselves forward so they can be the best version of themselves for their family.
Great. That was great. I think in terms of, I want to capture some of the benefits of being mobile, and like why being mobile as a service is important. I don't know, I can't articulate it in a question, but I do want to get kind of your perspective as to why that mobility is such a big part of serving maybe underserved communities.
The mobility portion of it is so important because the hospital can be very intimidating. Parking for one, and location, the different floors, the elevator, everything is so brought forward to you that you're just like, I don't want to go. Mobile, we're right there. Your parking is going to be right next to where you're going to be served. As soon as you come onto the mobile, you're going to have a smiling face ready to greet you, and then you're going to directly see your providers there, and then you can learn or feel the trust and know that you are in the best hands. And also mobile provides us to go in different locations to where it's a different demographic. There are different languages, the cultures expand from, where we have women that are newly from South America, or you have people across seas that have come from Africa. I mean, it's everywhere, and we're basically extending our fingers to say, hey, come on in. It's so easy, but we're also very diverse in that too. I mean, we're ready to help anyone.
Yep. And we just get to go where people are on a mobile unit versus making people come into a clinic setting or hospital setting, and it's efficient. You get in, you get out. Like Olivia said, it's a fast process, and yeah, it's easy. It's hopefully feels really welcoming and not intimidating at all is our goal, and we get to provide a little bit of education and spend time with our patients because we're not in that clinic setting with so many patients coming one after the other. It's like we get to spend a little bit more time talking about women's health and our bodies and healthcare in general, so it's kind of cool.
Gotcha. Can you introduce yourself and also say who you're with? It's just more so for the start of the video. Yeah.
Yep. Okay. Go for it.
My name is, I'm sorry, I'm all. I guess this is where I zone out. Okay. My name is Olivia Sines, and I am the mammography technologist for Denver Health.
And my name is Morgan Bussey. I'm a family nurse practitioner working in women's health on the mobile unit.
Sweet.